Access to care is probably one of the things I'm most passionate about. People should be able to access quality care when and where they need it. And it's a wicked problem of how to get people access.
Before, communities just didn't think it was an option to really have access to services, especially behavioral health related services, because there was just shortage. There's shortages all over the nation for behavioral health services and providers. There's shortages in urban areas, and there's surely shortages in rural areas. Healthcare systems and state agencies are so busy providing the day-to-day care that Texans need. It has limited opportunity to innovate, to step back, to look at the whole landscape. The Telehealth Institute is going to innovate, it's going to research, it's going to educate future clinicians and provide options for key decision makers on how you can do it, how you can implement those changes, and then how you train your workforce in order to achieve that goal.
This started as a pilot project in partnership between the College of Education and the School of Public Health, where Public Health came and said, could we use the psychology doctoral students to reach Leon County, Texas? And that was where it started. We built the telehealth counseling clinic at the School of Public Health, which then became the telebehavioral care program in the College of Medicine, and is now today the Telehealth Institute. I've always been a dreamer, and I did not expect this transition into being able to do our own work. We have 3 cores: research, education, and clinical service delivery, that are all reaching out to other faculty to amplify the work that they're doing.
Research is really critical in understanding the science behind telehealth, and in some cases, telehealth can be better than in-person treatment. Our Research Fellow program works with people across the Texas A&M system interested in doing telehealth of all sorts, and we provide networking opportunities. We also have grants development workshops where people can really focus on deep thought to innovate around telehealth. And then we support grant submissions to expand the field and the science related to telehealth research.
I see the Telehealth Institute bringing that research to healthcare stakeholders and decision makers on what needs to change in terms of policies, healthcare policies, payment policies, on structuring how it is that you administer health benefits in the state of Texas.
The Telehealth Institute's education model is unique because we're able to train up providers in a virtual setting across the entire state of Texas, as well as globally, getting actual training in how to treat patients from a technological standpoint. But they're also understanding the importance of collaborative care and being able to address more than just one specialty. So they're getting an all-around interdisciplinary training from our education core. Outcomes have increased, their travel times have decreased, while patient access to healthcare and specialized knowledge is being increased.
Telehealth has totally transformed clinical practice already. With our model, we take a mobile clinic to a community 1 day a week, and then the other 4 days we're not there. And so it's important that those people have services on the days that we're not available. We have patients that are homebound or they have transportation issues, and telehealth has been extremely positive for those patients. The way that we do telehealth with our schools, we utilize the school nurse as an extension of our workforce.
We have a clinic where a nurse practitioner will see patients in a container in Sarita, Texas, in Kennedy County. That unit's actually right across the street from the school. Counselor at the school, she'll be able to walk children across the street to have counseling, something they've never had access to. Showing up counts. They've been in a desert and people haven't been showing up. So how can we impact that? By rotating our students out and letting them see what real practice looks like, hoping that some of those students will choose to say, hey, I want to go back and serve in this underserved community.
Healthcare should be person-centered and delightful. We get that in all of our other consumer roles, that we don't continue to access or buy things if they're not delightful and useful and helpful. And I think that healthcare should do that. And I think that telehealth and technology will make that imprint onto the healthcare system.